Hi folks, Dr. Ed Beyer. Today we're going to talk about autoimmune disease, which is very prevalent in our society. What autoimmune disease is, it's where your immune system, your white blood cells, are mistakenly attacking certain tissues in your body. There are over 80 different autoimmune diseases. We're going to talk about one of them today called celiac disease, or sometimes they call it celiac sprue. And we're going to talk about that in a little bit, but I want you to know that in our clinic, we manage and support people with chronic illness from a functional medicine, a functional neurological point of view. It is a disease where you eat a molecule called gluten, which is a protein in wheat, barley, and rye, and there's a portion of that molecule called gliadin. And certain people, when they eat this, they have their immune system attack it as if it's a germ. And that's called a gluten sensitivity or gliadin sensitivity. Now, 5% of people who react to gluten will develop celiac disease. There's a lot of misunderstanding on this, okay? Many of us, including myself, are sensitive to gluten. When I eat gluten, I get a reaction. My immune system reacts to it. But only 5% of the people who have gluten sensitivity go on to develop celiac disease. Celiac disease means that when you eat gluten, not only will your immune system attack the gliadin part of the gluten molecule, but it starts to destroy these little outpouching, what we call the microvilli in our small intestine. Lining our small intestine is a one-cell layer that's a very important layer that lies between our gut and the inside of our body. And the reason why we have these little finger-like projections is it increases the surface area so that we can have a large amount of surface area to absorb our nutrients. That's where our nutrients get absorbed in the small intestine. These are called microvilli. When you have celiac disease, you eat gluten, not only will the body attack the gluten, but it starts to destroy this villi, these finger-like projections. Instead of it being like shag carpet, the lining becomes more like flat carpet. And you lose these finger-like projections and you start to not absorb certain nutrients, and then you get a whole onslaught of a bunch of symptoms, nutritional deficiencies, anemias. If it happens in a child, they won't grow. And so there's just a bunch of different things that can happen. Now, the thing I want to teach you is, some of you know that you're gluten sensitive or you have celiac. There are a bunch of other proteins that may be in other grains like corn or rice or quinoa or sorghum, that if you react to gluten, you may be reacting to these other proteins in these other grains. We test for this so that the patient knows exactly what to eliminate from the diet. We also know that patients who have this are going to have a bunch of nutritional deficiencies, and we need to get those nutrients back into the body. So if you suffer from any autoimmune disease, from celiac, and you're still not feeling the way that you want to feel, you need to come to the seminar on the 30th. I'm Dr. Beyer. Hope to see you there.